So, how has the speech and language therapy service adapted during COVID? There have been a lot of adaptations and changes to the speech therapy service during COVID. So, greater use of remote working where possible, a shift to more electronic ways of recording our notes, and I think some greater flexibility within the team and some upskilling where necessary. We've also seen that often COVID negative patients might be discharged from hospital quicker than we would have previously seen, and that might mean that their speech therapy episode of care is not complete. Community speech therapy services in some areas of Southampton were already very stretched pre-COVID, and the pandemic has obviously put extra strain on these services. So the speech therapy team therefore kind of made the decision to set up a telehealth service for suitable patients who had been seen during their inpatient admission, but had an incomplete episode of speech therapy care. Other than the ENT SLT service, which is an outpatient service, the UHS speech therapy team is solely an inpatient service, and so this new way of kind of community type working has been a little bit challenging at times. Developing the service did have the benefit, though, of ensuring that with reduced staffing because of self-isolation, shielding, anything like that, the team was still able to prioritise those patients most in need during their inpatient stay, because those who were being discharged could be quickly followed up, and so didn't need potentially those short notice reviews during their admission before discharge. So what is RUSOS? So RUSOS, which stands for the Remote UHS SLT Outreach Service, is a new telehealth service that the UHS speech therapy team have set up as part of the COVID response. Under the service, patients who were known to speech and language therapy during their inpatient stay and fit a set of eligibility criteria regarding their physical and cognitive function, as well as their level of risk, are seen remotely via a video appointment for further assessment and managing of their swallowing and communication difficulties. These consultations take place using the Trust Recommended Attend Anywhere platform. And the aim of the service is to reduce the number of patients who are being referred on to the community speech therapy services, which currently have significant waiting times. And the end goal of this is just maximising the efficiency of patient care and improving the patient experience. The RUSOS service is also currently being offered to UHS speech therapy's caseload of outpatients who present with ENT-related voice, swallowing or upper airway disorders, and this is due to the absence of face-to-face appointments as a result of COVID. So how do we risk assess who is suitable for the service? Patients who are seen as part of the RUSOS service must fit a strict set of eligibility criteria, which is particularly important for those patients who are being seen with swallowing difficulties or dysphagia. At present, all previously acute inpatients seen under RUSOS will have had at least one prior assessment by a speech therapist during their admission. So that means that their level of risk of, for example, aspiration or choking can be better kind of gauged and understood. Patients who are seen as part of the ENT speech therapy caseload will have had a prior appointment with an ENT consultant, which will involve imaging of the pharynx and the larynx, which again can help with that kind of risk assessment. Except in a very small number of kind of very carefully risk assessed cases, all patients seen under the RUSOS service will be having some kind of oral intake already, probably modified consistencies, but they're unlikely to be nil by mouth and starting from scratch, as it were. We also ask that as part of the service, all patients being seen have another responsible adult with them present during our swallowing assessments, just in case any difficulties or emergency situations such as choking arise, then the appropriate help can be called. A large proportion of the acute speech therapy caseload is made up of older patients who often reside in residential or nursing homes, or who have frequent carers come into their own homes, and so that really helps to facilitate that second adult being present. So what would be my top tips for completing a video consultation with a patient who has swallowing or communication difficulties? I think my first tip would be to ensure that you do adequate preparation before the appointment time. So that can be as straightforward as making sure your laptop or devices are charged, or you have an appropriate space that is quiet and confidential. Particularly for our swallowing patients, it's important to make clear to the patient or carer what resources will need to be provided by them for the appointment. So things such as food items to trial. As obviously speech therapists would usually provide these face-to-face, but that can't be done via video. My second tip would be that an extra pair of hands to help the patient is often really useful. So as mentioned earlier with our swallow patients, we do ask a second adult to be present for kind of risk mitigation. But even with our communication patients, it's really useful to have that second pair of hands to position the device and things when the patients are doing certain activities or trials to enable us to get all the information that we need from the appointment. My third tip would be to ensure all of your resources are accessible in the same way via video consultations as they would be face-to-face. So this is one that's particularly important for our communication patients because tasks and activities often have to be presented differently via video. I would say it definitely helps to practice before you see your first patient. My fourth tip would be to make sure that you have a backup should the video consultation not go to plan. Technology is great, but it's not always our friend. So it's useful to have things like the patient's telephone number to hand in case you need to revert to a plan B. And I think my final tip would be, if the patient is cognitively able to ask for more frequent feedback from them during the assessment. So particularly again with our swallowing assessments, video consultations are really good, but they don't necessarily lend themselves to all the observations that we would usually do as a speech therapist when assessing. So asking the patient or the second adult present for feedback on what's being trialled, what they can see that we might not be able to see via that video, is a really useful alternative to all the usual observations that we need to do as part of our assessment.